I'm sitting here again with Reverend Mines, and we talked about healthcare. We talked about COVID-19. Let's talk about McGuire Hospital, all right? Veteran Hospital, over here on the South Side.
Yes.
And I'm sitting here and I've thought about it on my way coming over here, all right? If you look at the wages, all right, that's being paid, and you're looking at the nursing homes now with abundant African Americans, people of color, is getting sick. Because we are on the lower spectrum of the pay raise, with the economy the way it is, we're being exacerbated, we're being pimped, we're doing all the jobs, okay? But at the same time, we're not given the equipment nor the pay. So I'm looking at where we are, Southside Plaza, then you're looking at being able to catch the bus. How can we not be carriers when they're not even giving us the materials that we need to test?
This is correct. Because we lack mass testing, we have no way of knowing how many people are actually positive or how many people have actually recovered from the disease and didn't even know they had it. Because we have so many people who are asymptomatic and some people who are who've actually gone through the full process and they can still catch it again. There's doubt there. We have no facts. It is impossible for medical staff to treat this disease without the proper equipment. And as Clyde stated, we have many professionals, medical professionals, particularly African American, in our VA hospital here at McGuire and different facilities throughout the city of Richmond, who do not have the protective gear that they need. That is ridiculous. How can you put a nurse or a doctor in the face of this virus without the proper equipment? This has to end. That is why I said our federal government has to step up. We have to demand that they do what's right. There is no reason why in this great country of America that we shouldn't be pumping out masks out of a factory. There is no reason.
You know, I sit here and I look at, in terms of people of color, the work that they're assigned to do in these facilities, from the food service, from the caring, from the bathing, all right? Nobody's getting tested, and because they're being overworked and underpaid, everybody's catching it.
Yes.
All right? We're not saying anything about that, and then at the same time riding the bus. But then I want to take a little step further. Where are we going to be in terms of all this new construction that's going on in Richmond, and the people are not going to be able to afford it?
Exactly. That, as I mentioned earlier in my statement, we have a variety of units being built throughout this city. Awesome, nice new homes being built, unit buildings going up all over the place, the South Side, you name it, wherever they are. But none of them are priced for the working class in Richmond. At least 40% of our population are excluded, can't even apply for these residencies. This is where this needs to quit. We need to quit this. We need to go for mixed income housing, which will also combat our segregation issue. We have to move away from loading up low income people in one area, one neighborhood. We cannot grow and be a better city unless we are truly in this together, where everybody matters, and it should not matter if your income is low or your education level may not be at the highest. You still deserve decent housing.
And on that note, if anybody want to get in contact with you, how would they do so?
You can contact me at Reverend Robin Loves, revrobinloves@gmail.com, or you can reach me at Robin D. Mines on Facebook. I look forward to hearing from you, and I pray that we can all come together and work together and come out better on the other side of COVID-19.
Thank you.